Now, though, let us look at the situation in the schools. You had raised, the NMA had raised fears initially. It would seem that the NMA is now reassured that it is okay for them to reopen on September the 22nd. But let's take a look at preparations, because some of the issues you raised is that it takes children a while to get used to hygiene measures.
Yes.
Has that perspective changed for the NMA?
You see, that's why we should try to understand that currently now there's children in their houses. Mm-hmm. And since this outbreak started, at least we have had a lot of public awareness. And this awareness are in our homes. These same children are in the homes, don't forget. And they also go to churches. This same public awareness about personal hygiene, washing of hands, cleaning of the environment is also obtainable in your houses, in the churches, and probably some summer schools they go to now. So by the time they all now go back to school, where, yes, there are more children, we agree there are more children, but the sensitization has increased amongst their teachers. And as soon as they come to school, it's been proposed that we have a lot of sanitizers, hypochlorite impregnated water for them to wash their hands with, adequate provision of soap, and then the environment should be ensured that it's very clean. It's a bigger thing for us to have an index case, a new case now. For us to have a new case now, it's not directly going to go to a school and start, infecting people. It will probably be someone who has traveled from a region where the thing is currently being a problem. That's countries where we have a lot of prevalence of people having Ebola. And once that person comes in, there are measures on ground to curtail this. And like he said, even if we say we are resuming in next year, April, what if another case comes in October, another comes in November? We're still going to try to curtail it the way we've done so far and ensure that they are properly isolated, managed, and discharged when we feel they are fit and free of the Ebola virus.
So would you have said that this was a false alarm?
Oh, well, it's not out of place for people to feel that way. Because the way the Ebola was, initially you had when somebody sent a message that people should take their bath with salt water. Did you see the responses? Do you know the number of people that died from that? In Nigeria, we are able to, before we properly internalize information, we respond abruptly, spontaneously. You get what I'm trying to say? So that is more like I don't want to say culture, but more like our nature. So when you now say children should go to school, these children are in homes. We are all in Nigeria. You understand? The assurance we just needed was that adequate measures have been put in place for schools to be able to control this outbreak from happening in those schools.
Now, it wasn't just the NMA who
Yes.
raised an alarm. The Nigerian Union of Teachers also did as well. What measures should parents, because they're the ones who are would I say, apprehensive about sending their children back to school? A lot of parents have said, well, schools can resume, but I think I'm going to keep my words home until I'm sure that everything is in place in that particular school. What should they be looking out for in terms of sanitary conditions to ensure that the schools are truly ready to take the children back?
Well, the schools should ordinarily have adequate environmental hygiene. That is, I don't think it's because of Ebola that should be in place. Mm-hmm. Ordinarily, we should have that in place. So what we're looking at now is contact. How do you prevent body fluids, hand transmitted dirt, germs from going from one person to the other? So by the time you get to the school, before you come into the school, there should be something there. One, somebody checking the temperature to be sure, okay, this person is not running a high temperature. Secondly, the person has a means of sanitizing before you come into the school premises. And then in each class, there should be measures of sanitizing when you come out of the class and go into the class.
Looking at this question from Bozimo, he sent a tweet here. He said, the question we should be asking is, what form of prevention and detection protocol schools now have? And these are some of the things you're saying, but we should be having some of this would have been more or less like a done deal to say we now have them in schools as we look towards resumption. Is there any collaboration between the health educators that you know in maybe some health facilities that have worked with some of these schools in ensuring that they already have these, so that as they come back to school on Monday, they already have them in place?
Well, I'm aware that the Ministry of Education, the Federal Ministry of Education, is working in conjunction, in collaboration with the Federal Ministry of Health. I'm also aware that the state ministries of education are seriously, at least I'm in Lagos State, working in conjunction with the State Ministry of Health. And they are putting everything in place to ensure that this outbreak is curtailed, proper hygiene is optimized, and all preventive measures that are supposed to be in place are in place. Now, it is, in Nigeria, we say a lot of things. We put a lot of policies forward. There are several schools, public and private. The private ones probably are more likely to be very hasty, or they are more likely to be able to implement this fast because they know the repercussions if things go otherwise. But what I feel we should pay more attention to is how much is happening in the public schools, because these are government schools. How well are they prepared for the children?
So you're saying that with that collaboration between the two ministries,
yes,
at the federal and state level, by now they should be having all of these.
Like I said, they are invited teachers for training. As regards this, yes, this has happened. At least I know of two. I go to Lagos State Ministry of Health, and I know they've been doing that.
Oh, that's good.
So I'm sure before they resume, a lot of better things should be in place.
But speaking about this, the concern has also, perhaps I should suggest, or from what you're saying, the schools, it's a public place, so they have to put in place all of those things. Yes. But what of other public places? Do we have the same kind of impression and demand that they put in place this kind of protect measures in public places?
Yes, they do. Like when I go to banks, before I go into the bank, they check my temperature, and then I get to wash my hands. They have sanitizers. And then if you come to hospitals, like I work in a hospital, so that's where I go to mostly. Before you come in, you're checked, and then you are given access to wash your hands. And then other bigger facilities, I know there are places where you're ushered to go somewhere, wash your hands, and they use a dryer. They don't, they don't want you to use any napkin to wipe your hands because that will cause contact. So, and these were not there before. Okay. And then
Tell us about this, because we did hear, we had to double check if it's still happening, where hospitals, even some doctors, are rejecting patients who come in with any symptom whatsoever, even if it's similar to Ebola, for instance, and patients are dying. I say, you heard about that, haven't you?
I heard about some hospitals doing that at some point, but I don't think it's happening anymore. People are now more enlightened. You see, at the initial stage, that happened, and it brought like a stigma to first consultants. But that's been cleared now. There's been assessments to show that they are free of Ebola and people can go back there. The hospital management probably didn't want them to be identified and isolated. That's why some people did that initially. But the simple truth is, patients are, where the patient is said to be suspected to have, be a potential source, there are means of isolating the person. You call the Ebola helpline, that you call people who isolate them. They come to get the patient because there are special ways of handling them. It's not just anybody that can handle them. And they are taken, they are assessed, and if they are qualified for isolation, they get isolated.
So you would say that malaria patients are not being isolated unnecessarily under the suspicion of having Ebola virus disease?
Well, before you can say the person will get fully isolated, there are certain procedures that are put in place. You take history, has this person had any contact? You take proper investigations, and from the history, examination, and investigations, this will be able to tell you, no, this person is a potential source. Let us isolate. Okay. I don't think there is undue isolation of patients with malaria. I don't think so.
Undue, but there is some isolation.
There will be some. There will be some because of, but at this stage now, it's not as rampant as it was like 4 to 6 weeks ago.
Okay.
All that has come down now.
Is that good or bad? Because a lot of people are thinking that, is it as a result of education, or is it as a result of, you know, the fears being calmed, or is it that people are beginning to let their guards down?
I don't want to say people are beginning to let their guards down. There are daily reports. The commissioner will give his reports. The minister gives his reports. So because of this control, what they come out with is, as of today, there's just one person in isolation. And that is in the whole of Nigeria, that as of today. So compared to some weeks back, where we had about 10 in isolation, and then some, like 3 or 4 were positive, and they were recuperating well. So you know the statistics have changed now. So people are following what is happening, because of the fact that those managing the health ministries are carrying people along. So that's why I believe people, I think this thing is being controlled here. So we can shake a bit more and hug a bit more.
Okay, so on that shaky note, we'll have to end it. Thank you for coming on this morning.
Thank you very much.
Okay, then we'll be back in just a moment here. Join us again.